Well, I think it's important for us to share with the American public what's happening on this floor in the House of Representatives. And you know, so many suggest that the history that drove Medicare to be developed, the dynamics that were so impacting on the senior community across this country, coast to coast, could be revisited if their proposal to end Medicare, the Republican proposal to end Medicare, were to take hold. And I know Representative Courtney, Joe Courtney from Connecticut, understands that. He has shared those concerns over and over again, that we could go back and revisit history of 45 years ago, 46 years ago, when people literally were impacted by cherry picking going on, where they couldn't afford programs, policies, even if they were offered to them, and many times they couldn't get policies written to cover them. And Representative Courtney, thank you for joining us this evening on what is an important bit of information exchange for America. They need to know that the seniors are at risk.
Thank you, Mr. Tonko, and I want to thank Congressman Garamendi, who did great service as Insurance Commissioner in the state of California, understands these issues intimately. I think this is really a generational gut check for our country in terms of whether or not this attempt to butcher Medicare, one of the most successful programs in American and world history, is going to succeed or not. John described very powerfully the public wards and the public hospitals and the third-tier status that seniors had prior to 1965. Kaiser Permanente actually did a study in terms of just reminding us of what this country faced when President Johnson signed that legislation on Harry Truman's porch step. At the time, Medicare passed, only 50% of seniors over 65 in America had health insurance of any sort whatsoever. Part of it was cost, part of it was the underwriting rules, but part of it is just as Mr. Garamendi said, I mean, age is a factor which carries risk, and there is no insurance company that evaluates risk within its own book of business that can really take all comers when you're talking about a population 65 and up. Life expectancy was 70 in 65. So we passed Medicare, and what happened is we created a guaranteed benefit, a pool. The genius of Medicare was that we pulled the risk, and we actually made an affordable system financed through payroll taxes, premiums, and the system has had its ups and downs financially over the last 45 years, but the fact of the matter is we now have life expectancy of 78 in this country. It has worked, and we have also alleviated the crushing out-of-pocket costs that seniors faced in 1965, and we have elevated the status of people in that demographic in a way that the private insurance market just was totally incapable of doing it. Last year, we passed the Affordable Care Act, which modified Medicare and made some important improvements and changes. We now have annual checkups covered. We now have cancer screenings. We now extended prescription drug benefits. And one of the things that the Republicans, in trying to sell this measure with snake oil, frankly, is that somehow people who are 65 and above today will not be affected by passage of the Ryan plan. In fact, we know that if you look at that plan, it cancels all of those new benefits in year one. So seniors who now have hundreds of thousands have gotten their annual checkups in the last 8 or 9 months since the new benefit kicked in, cancer screenings that kicked in, prescription drug assistance that's now providing help for seniors in the donut hole, all of that would be canceled today. And any prospective change that is proposed in this system, which again will, starting for individuals 55 and under, now be left in a private insurance market with a totally inadequate voucher, as Mr. Garamendi said. Again, that's where the real butchering of Medicare takes place. But there is no question for anyone who's listening tonight that if you are a senior citizen on Medicare, the false claim that you are somehow insulated from this measure because of the fact that you're already in the program, that is something that people have got to recognize and understand, that new benefits that are making this a smarter, more effective program are going to be canceled in year one if this measure, God forbid, ever is enacted.
Well, very